Over the last few decades, breast cancer has become the single most common cancer among women in India, especially more so in urban India like Bangalore and other metro and other urban parts of the country. So, the single most important symptom that a woman of breast cancer develops is a lump in her breast, and most often the lump is painless. And because it is painless, many women delay seeking an opinion or a consultation from their doctor because they feel it is harmless since it is not causing pain. Very often they are shy and they do not want to express to their family or to the doctor that they have a lump in the breast. And this is the main misconception that we need to clear. More and more awareness is increasing among women in India, and therefore we see a lot of cases where women actually do present early. In fact, we are also seeing women presenting with non-palpable lumps, that is, lumps which cannot be felt at all, but which are picked up on mammogram during a process of routine screening. And cancers picked up at such an early stage, either by mammogram or by a small lump felt by the patient herself, have an excellent prognosis. So, in stage 1 cancers of the breast, for example, we are able to achieve cure rates of over 98% now. Once a lump is diagnosed, the evaluation includes doing a biopsy and some imaging tests, so certain scans to know what is the diagnosis, confirmation that the lump is a cancer, to know the type and subtype of the breast cancer, and also to know the stage, that is, the extent to which the cancer has spread, whether it is localized to the breast itself, whether it has gone to the lymph nodes in and around the breast, or whether it has gone to distant organs. Once we know the type, the subtype, and the stage of the cancer, then the treatment is planned. The main treatment for curative treatment of breast cancer always involves surgery. So, surgery very often is done in the beginning, but sometimes it will also be required that the patient undergo certain treatments prior to the surgery and then undergo the surgery. So, there are a lot of changes happening in the oncology realm in breast cancer. So we have now, in addition to surgery, we used to have chemotherapy. We already had chemotherapy. Now we are also talking about targeted therapies and immunotherapies in breast cancer. We also require radiation for certain subsets. So it's a complex realm, and the interdisciplinary involvement of multiple doctors, including the surgical oncologist, radiation oncologist, and medical oncologist, are all important to come up with the best tailored plan for an individual patient. Apart from this, the role of psychosocial services who counsel the patient, take care of the psychological needs is also important. This is especially so because the breast cancer comes with a lot of emotional component as well. And since there is a very high chance of cure and a long life for these patients, you must not neglect the emotional component which goes alongside a diagnosis of breast cancer. I would like to emphasize certain things about surgery for breast cancer itself. The majority of women with early breast cancer nowadays undergo a lumpectomy. That means the removal of the entire breast is not necessary and only the lump removal is sufficient. In addition, the major morbidity, that is the major side effect of breast cancer surgery, used to be due to the surgery done in the armpit to remove those lymph nodes in the armpit. Nowadays, most of those lymph nodes need not be removed for early breast cancer, and we do a technique called a sentinel lymph node biopsy, whereby we selectively sample barely 1 or 2 lymph nodes and analyze them. So, by doing that, we avoid keeping a drain in the armpit. The patients don't have to carry home a drain or don't have a drain after the surgery. Their arm movements are completely normal. The risk of swelling of the arm post operation is minimal to nil. So these are advances in surgery, and there are many more aspects of reconstructive surgery that we are into now. It is called oncoplastic reconstruction, wherein the breast looks almost as normal as it used to be before the operation. There have been advances in radiation as well. The long time of treatment of radiation for many weeks is now shortened to a very short time right now. So radiation is shortened, surgeries are done on a daycare basis. That means we admit the patient in the morning and we can send them home the same day or early morning the next day. Radiation takes very little time, and chemotherapy also, the side effects have been much better managed. Many women don't require chemotherapy at all. We have genomic testing which allows us to identify the patients who actually require chemotherapy and those women who do not require chemotherapy at all. So these are advances in breast cancer management that is happening on a day-to-day basis. so that we can offer the better and better care for our women with breast cancer, at the same time achieve the best possible cure rate.